Stacey Gualandi, and this is Luxe News Live, and my guest today is one of Las Vegas's finest plastic surgeons, Dr. Hayley Brown.
Hi, Stacey. I'm so happy to be here today.
But now, for you, you could have probably had your choice of types of medical fields to go into. Why plastic surgery?
Well, that was something I always wanted to do, plastic surgery, and when I went to medical school, that was actually my intention, so there was never any question about what I wanted to do. And I grew up in a family of physicians, so I was always exposed to the medical field and spent a lot of time in the hospital following my dad around and things like that. And I was also always very creative and artistic, and even now art is kind of a second passion for me.
Oh, great.
And so,
the hobby, right?
Yes, I do a lot of different types of art and different projects, and I always have something going on. So it was just actually the only medical field that it really combined the two, where you can actually kind of see your work, where you can visually appreciate your work, versus something like general surgery or something where there's no visual appreciation of anything. You just wanted to make sure the patient was well. So it's different, and my patients are healthy, and it's just a really fun, exciting field to be in.
Well, so now how many years have you had the Desert Hills Plastic Surgery Center?
So I opened up Desert Hills Plastic Surgery Center in Henderson in 2000. So we're going on our 18th year.
And in that time, what do you think has been the key to your success and why your clients, why they love you? Why do they keep coming back?
I think, I'm one of the few board certified females here in Las Vegas, and I'm also a mother of 4. So, I've been through a lot. It's a lot, but it's a really nice balance. So, and I'm also really involved with the community, with the kids, and then we do a lot of charity work in the community as well. And so I think a lot of my patients, which are mostly, female, I would say, they just tend to connect with me, and we have a lot in common, and I have a little bit of the mom practice in town, and so they just, word of mouth and gets around, and they just come, so.
Because obviously there's so many services out there, like what you're providing. So
yes.
In your instance, what is it that you wanted to do differently, perhaps, that other practices are doing, or what sets you apart from other surgeons that are out there?
Well, I'm really just driven by meeting people, and I really enjoy bonding with people and connecting with people, and I have just a genuine concern for the patient. I'm not my husband works with me, and he's a board certified anesthesiologist, and we're kind of a team approach, and I love what I do, and I take pride in my work, and I really just want to see the best possible outcome for that individual who comes. It's also rare, and me and Steve are the only people in this community who are a team. So you've got 2 doctors as a team working side by side, and that really ultimately
who love each other.
Yes, we do, and we get along great, and it just really translates into patient comfort and patient safety, and so it's just kind of a genuine joy, and we love to do what we do. So
are you very specific with the types of procedures you do, or do you pretty much do everything that's out there?
I do. I love operating, so I am mostly surgical based. I love doing that, but I do a lot of different things. I like doing facial rejuvenation, and then I have a huge experience with breast contouring and breast implants and breast lifts and reductions, and then all the body contouring as well, such as tummy tucks and liposuction and things like that. And I love the variety. I mean, it really it keeps me stimulated, and it's, every patient's different. And right now, there's been a huge trend in performing what's called a mommy makeover, which is breast and body contouring all in one surgical setting. And being that, my patients are mostly mothers, it's been a very, very popular procedure, and I love doing those.
It's interesting. So it is mostly women and
yes.
of the mommy age.
Yes, for me, that's what my practice kind of attracts, and I love that.
Because they also feel because you're a mom too, and
yes.
So you know what you speak. And
yes.
so it helps. For someone like myself, if I came to you on any given day, what is it that you tell your patients when they come in there, as far as unrealistic expectations or something?
I'm not someone who tells someone what they want to hear. I'm not a sugarcoater by any means. I'm very, very honest. If anything, I will under-promise and over-deliver. Because I think that's so important, to patient satisfaction, and you have to work with what you have to work with. This is not magic. Really everything is very logical, And you want someone to look beautiful, you want someone to look natural. I mean, I think that's really important.
Yeah, what feedback do you usually get from your patients? What are you hearing mostly?
Patients, I mean, if you get online and look at all my reviews, I mean, they talk about how bluntly honest I am.
Well, that's good, because you feel that a lot of physicians out
yeah,
there
they
are
don't,
not.
or they're driven by, I'm not really sure, but
interesting.
so you hear that all the time, that I'm almost brutally honest in a way, I guess, and people just admire my work. Like I've got a lot of before and after photos online, so it's like really like presenting your art out there. And I get compliments all the time on the photo galleries, and the breast lift, the breast reduction patients, and how good they look afterwards. So I really take pride in everything I do.
So if somebody were to come in and say, I want like a full facelift or something, and,
yes.
and I want a breast enhancement,
yes.
and if you feel that those aren't appropriate,
I will tell them.
Okay.
Yes. Yeah, I mean, you have to be healthy, you have to be motivated, you have to have a great attitude, and you have to be realistic, or it's not going to go that well for that person.
And they'll listen to you.
Oh yeah, they do. Yes.
Yeah. And they'll try to do something else instead.
Sometimes they all come back though, and they all come back. So everyone's charts get thicker and thicker and thicker. So they'll come back for more, it seems like.
Do you feel that you have accomplished all the goals that you set out for when you began this?
Yeah, I mean,
journey?
it's actually been great, and I don't see myself going anywhere. I mean, the practice is just blossomed, and it's I love what I do, and I can control my hours, and I can the patients, I've got just such a great clientele, and a lot of the patients have become close friends, and they come back and visit us. It's like a big family, and then just being able to work with my husband is just really unique and somewhat special. And I love it. I've got great staff too, which is a plus, and so we have fun. I mean, there's a lot of laughter in the office. And
do people always ask you like, what's it like working with your husband?
It's good. I mean, it's good in that he does his job and I do my job, and we're separated in the operating room by a curtain. So he's in. It's not like we're like on top of each other that way. I mean, I trust that he's taking care of the patient and he knows what I'm doing, but I'm not really talking. I'm doing what I'm doing. So.
What do you see as maybe potentially trends for the future, and how do you want to be a part of that, or how do you feel that you're going to, stay in that traditional space, do you think?
Well, there's more and more technology coming out for facial rejuvenation and things like that. I mean, I do hope that at some point in the future there will be some sort of non-invasive treatment for skin tightening that is effective, and I'm waiting for it, and I'll be the first one to have it done when it comes out. So hopefully something like that. I'm hoping that one day they'll have a longer lasting Botox. The fillers, we have so many fillers. We get new fillers. There's almost too many to use, as well as the breast implants have gotten better and better. So we have so many choices when it comes to breast implants now. With you hear about gummy bear implants and just different types of silicone implants, and there's a lot of variety to choose from. And breast just you can get very beautiful, natural, long-lasting results with some of the newer implants that are out.
It's implants as well as explants.
Yes, and actually the trend, which is national, and also I've really noticed in my practice, is a trend towards smaller breasts. So, you have a lot of women who've had implants in for a long period of time, and they want to be smaller. And so what I do very commonly is I'll take implants out in women and then do a breast lift, and they'll have like either a fuller B or small C cup, and they can go around and look more like a model and not have to wear a bra. And people love that, and that's definitely a trend I've seen in my practice.
Interesting.
Mm-hmm.
Yeah. For you, because I'll brag about you, because you're the accolades, the awards. You're one of only 3 board certified women in Las Vegas.
Yes.
Congratulations.
Yes.
But then again, how come so few women, do you think?
I don't know. There's many more in some of the other, busy cosmetic surgery cities like Beverly Hills and Scottsdale and things like that. We've had a few kind of come and go, but none have really kind of stuck long term. And the great thing about practicing here that I think is like we all get along. So we're close, and all of us get along. I feel like I could count on any one of my colleagues for anything, for backup, for questions, for anything. And that is not common in a city. So that's one of the reasons I do love practicing here, is because we get along and we support each other. We're not against each other. And I think that's an amazing thing. But why there's not more women here? Well, it's always been male dominated. I mean, this field. I mean, you know, when I did my general surgery residency, I was like the only woman. But it was a long time ago. But I was the only woman, and I think it's just a long road to become a plastic surgeon. It's a sacrifice, you know,
and to be successful.
And then, you know, to balance having a family as well. I mean, so it's just, it takes a long time to get to this place. I mean, once you're here, it's amazing, and I can control my hours and everything like that. But I mean, it was a sacrifice.
Talk to you like 15 years ago, right?
It was hard. I remember starting my practice, and I mean, there were some rough days. I mean, I just basically started on my own, and you have people saying you can't do this, you're never going to succeed, you're never going to be able to do this.
Does that make you motivated more to do it?
It's scary.
Yeah.
The responsibility is scary. Just being on, just everything is everything and it's stressful. And when I started, I worked at St. Rose Hospital, and they actually kind of helped me move out here because that Sienna Hospital had just been built in Henderson, and they didn't have any plastic surgeons on staff, and so they needed to staff the ER. So for 5 years, I did ER call. Every night I was on call for that ER.
Wow.
And then eventually built up the cosmetic, practice, which is actually my passion. But it was hard. It was hard, and it was stressful. I mean, there were like 5 years there at the beginning that you just question, everything.
How did you get through it?
Yes, or am I going to be successful? Or is, you always worry about, like, I don't know, people coming to you or not coming to you, and just being on call, like, really 24 hours a day without being able to turn it off, and so it was hard. I mean, now it's amazing, like I said, but it is a sacrifice at the beginning, there's no doubt.
Just, last question, in terms of just at the end of the day, can you literally pat yourself on the back and say, you know what? This is what I've done. This is what I've accomplished.
Oh yeah. I mean, I love what I do, and I'm really proud of everything that I have accomplished. So, and I'm so happy that I've been able to have children, all raise 4 children at the same time.
That's amazing. Any advice for somebody who wants to follow in your footsteps?
Well, yeah, I mean, you really, people say I can't do this, or I can't, I've got to focus on my career and then have kids, and you don't have to do it. You can do anything you want to do. You just do it. And I was pregnant during my fellowship. I was doing my plastic surgery fellowship for 2 years, and I was pregnant the whole time.
Oh.
And so I had back-to-back babies. I was pregnant the entire time. I took call. I didn't miss a day. I was up all night doing trauma call, and you can do whatever you want to do.
Yeah.
I mean, you don't have to put one aside, you just do it. You make it happen, and that's it.
Well, thanks so much for listening. This has been Luxe News Live with Dr. Hayley Brown. If you'd like to know more about her and her practice, just go to deserthillsplasticsurgery.com.